Thank you to MUHC, and it's been a real pleasure and a privilege to be part of the planning committee for today and to have an opportunity to speak, but really also to hear from many of the teams. I think you've heard several of them refer to the collaborative designed by and supported by the Canadian Foundation for Healthcare Improvement to support teams in organizations across the country in partnering with patients and families to improve care. What we had hoped to do in today's session, and I'm very aware we're short on time and we've had lots of great content already, but what we would hope to do is to explore a little bit about the relationships between patient engagement, patient experience, and quality improvement, and our thinking and our study of that from the Foundation perspective and what we've been learning with teams across the country around the connections. We also want to share with you some of the promising practices coming from organizations across the country that are emerging and some of the insights they'll share with you today. At the Foundation, really our mission is to help accelerate healthcare improvement, and we do that by supporting the spread of proven innovations. And I think what you've heard today and you're seeing is that patient engagement is an innovation in healthcare, and it's changing and improving how we design, deliver, and experience care, and also the outcomes of care. Our work is grounded in research, so we worked with Dr. Russ Baker and Jean-Louis Denis and team and said, if we look at high-performing health systems, what are the key attributes of those systems? And then we worked with them to say, how can we turn those key attributes of high-performing health systems into levers for improvement? So how might we work to develop programming and strategies and tools and supports for organizations to improve their health performance? And you'll see this is a wheel, and each of these are equally important, and you'll see on here engaging citizens and patients, and this is what high-performing health systems do, and we're committed to helping organizations across the country do. And as important as engaging frontline providers, and as you've heard today, the joint engagement and joint education and support for frontline providers and patients and families working together for improvement. So what that looks like in terms of programming is that we design and provide structured opportunities for organizations across the country to work within their organization and to work with other organizations across the country to build leadership and skill capacity, both at the leadership level, provider level, and for patients who are increasingly coming forward to provide patient experience and to advise us in our healthcare improvement journeys. We help organizations think about how do they enable patient and family engagement and community engagement within their setting and for the populations that they serve. We help them apply improvement methods, and we help by providing opportunities for them to participate in evidence-informed collaboratives. This is a cartoon I've been using for many years, and I have to say I was really struck today about how I think we've moved beyond this now. We used to think that patient engagement was about asking patients what they think, and while it includes that, it's about so much more than that, and we've heard about that this morning, and I think that's really encouraging and exciting. While I agree with Angela's comment about not getting twisted up in definitions, I think it is important and helpful when you're around the table with your team or in an organization to be clear on what you're trying to improve or what you're trying to accomplish. And so having some of those discussions so you have a common understanding can be helpful. This is one definition. It's a definition that we've evolved at the Foundation. It's been helpful to us in our work. And it picks up on many of the themes that we've already heard about today, that participation in a range of activities by patients, families, and caregivers, that they bring that lived experience that frankly is an expertise at the table we've been missing out in healthcare for a long time. And when we look at other sectors, they've been benefiting from that lived experience. And so it's so encouraging to see growing recognition of that and strategies for ensuring that we partner in meaningful ways to understand that experience. And that it's about true partnerships, and that's growing our understanding of what partnership looks like in healthcare. So collaborating and meaningful patient-family engagement is important and required for both improving patient family-centered care, how we respond to people's medical needs, but also their preferences, their values, and understanding their context. And it's also really key for improving how we design and how we evaluate the quality and the safety of our services and our system. There are many frameworks out there, again, and I think frameworks can be helpful in approaching how we think about and how we plan for and how we implement patient engagement activities, if I can call it that. This is the Carmen framework. It was published in Health Affairs, and it's really, in my view, a condensed version of the IAP2 framework. And actually on your programs on the left-hand side on the bar, you'll notice that continuum of consultation, involvement, and partnership and shared leadership. And it's a way of thinking about a range of ways of engaging and different ways of engaging for different purposes or different goals. From consultation, where it's more of providing information, to involvement, where it's more of an exchange of information, a dialogue, to really what we're focused on today, of partnership and shared leadership, where there's deliberation, there's new information being provided, new insights, and the co-creation of new solutions together. The other helpful thing about the Carmen model, I think, is it helps us frame the opportunities within our current healthcare systems of partnerships or engaging within direct care, your own care, within the design of services, and at the policy level. And it's been mentioned, I think, already a few times today, but just worth bringing attention to, that emerging evidence suggests that if we're after the kind of improvements that are highlighted in the clouds, improved health outcomes and appropriate use of services, improvements from an organizational perspective in terms of safety and efficiencies, and changes in how we allocate our resources, we need to be engaging at this higher end or more of this partnership or collaboration end in order to translate into these kind of improvements. We're going to skip over that. I've had the privilege and the opportunity to really work alongside, support, and learn from and with over 40 teams across the country over the past several years, and also to work with Dr. Ross Baker and Marie-Pascale Palmé and others as a research team to conduct some case studies in 3 countries, 8 organizations, to really say, what do we know about the difference that engaging or partnering with patients and families makes on the design, the delivery, and evaluation of our system. And what we found, this core idea that emerged, is that it's about the patient engagement strategies, but it's really more about this idea about how do you create the culture, the environment that supports engagement of everyone who needs to be involved in engagement. So you heard from Leslie this morning about how leaders set that strategic focus and really support and walk the talk of partnering with patients and families and learning from patient experience and patient voices. And many examples about how jointly frontline staff and patients are being prepared together and provided with educational opportunities. How do we partner in managing our own health behavior coaching, all these different new skills and tools, education and team support for new roles together in direct care, and also new roles in how do we enter into quality improvement endeavors together. So just a central idea, I think we're hearing it throughout, and really important as we think about how we move forwards together about creating the environments that are conducive to and enable partnerships. So you're going to hear you've heard already from some teams, and I'm going to hear from some more teams that have been part of our collaborative, 22 teams across the country who are really experimenting in their own context, bringing in what we know from the literature and the evidence about partnering with patients and families for quality improvement. It was designed when we were thinking about how could we support engagement for improvement, because what we heard from people is partly what Gary shared this morning too, is there's a lot of data information out there about patient experience. Sometimes there's patient-family advisory councils, and there's a lot of excellent work being done in quality and quality improvement, and they're not always connected. So this idea of how could we help support and enable that connection between patient experience and perspectives, quality improvement work to enable co-design of improvement is what we set out to do, and we're learning lots of lessons along the way with our teams. At this point, I'm going to turn things over to Patty, and she's going to tell us a little bit more about what we're learning when we look across our 22 teams, and then you'll hear from a couple of the teams who are part of the collaborative.
Based on what we have seen with the 22 teams of the collaborative, as well as previous work that I've been involved in over the last 5 years, we've come up with what we really think about as the 7 key attributes of engagement-capable environments. I'm not going to spend time going into this in any detail. We've heard an awful lot about it today. But first and foremost, most fundamental, is courageous, cohesive leadership who walk the talk. We've heard some lovely illustrations of that. We've heard from Leslie early this morning. It's critical. Recruitment of patient advisors with clear roles and responsibility at all levels of decision making. I suggest that you check out the CFHI Patient Engagement Hub. There are a huge number of how-to guides there. You don't have to reinvent the wheel. Creating a mutual learning environment for patient advisors, staff, and physicians to learn together is important. It's really critical. Don't do it in silos. Set up those learning sessions together. And in particular, what I want to emphasize is that you need to target your frontline staff. They're forgotten and overlooked way too often, and they are the key to your success. Build their quality improvement competencies together with patient advisors. Coaching and facilitation support, we just heard some excellent examples from what Murray was describing of why it's so important to have that facilitation expertise in the group together. Fifth, continuous feedback loops and outcome measurement. We heard from an earlier session how important that was, and Gary gave us some beautiful illustrations of how you, especially again at the front line, getting them, teaching them how to do some very simple pre-post measures, because that's what will turn their heads. It's not the administrative data that we're churning out at higher levels. You need both inside the organization, but frontline need to have measures that mean something to them. Resourcing is very important. My key message here is senior leaders in the organization are the ones who know where to tap into resources. Your frontline teams usually don't know that. So for those of you in the room who are a little higher up in that food chain, it's really important that you give some of that guidance and counsel and help them find the dollars. And last is an important one, and that has to do with the government roles and responsibilities, and in particular in setting provincial targets. I think that some provinces have done a better job than others, and it's frustrating to me that the governments don't use that lever more frequently and more powerfully. Set the bar, set it high, and make us perform to those levels. And think about incentivizing innovation and mandating patient partnerships, which has been recently done here in the province of Quebec. And just in leaving, I want to let you know that about the Patient Engagement Resource Hub, which is on the CFHI website, and as of October, it's now available as an app. So it's a tremendous amount of resources there. Just go there. It's one-stop shopping. It will take you all around the world in terms of best resources and how-to guides. Thank you very much. Easy break.